Alberta's Premier Jason Kenney is criticizing the response of Canada's Chief Public Health Officer to the pandemic. Kenney says Dr. Theresa Tam listened to talking points, as he calls them, from China and suggests she put too much faith in the World Health Organization. Kenney also says he intends to circumvent Health Canada and will not wait for it to approve new medications, tests, or vaccines for COVID-19. He says he intends to bring those things into Alberta as soon as they're approved by European or American health regulators. This is how Canada's Deputy Prime Minister responded.
We have shown that we are a country that does believe in the value of expertise and in the value of science at the federal level. I have observed as a former journalist that chief public health officers across the whole country have become this generation's rock stars, and that is entirely appropriate.
Alberta has expanded who can be tested for COVID-19. The province believes it now has capacity to test anyone with a cough or a runny nose. No other province is at the point of testing that extensively. Tonight, Heather Yourex-West examines why Alberta now appears to be ahead of the curve in its response to COVID-19.
As hospitals around the world scramble to obtain desperately needed medical supplies, Alberta has been flying in massive shipments. This cargo plane from China brought more than 36,000 kilograms of masks, gowns, and face shields.
There's a high level of confidence in the suppliers that we are working with, as well as in the transportation networks that we have established with some of the airlines in order to try and bring those things up.
Over the weekend, Alberta's Premier announced surplus medical supplies will be sent to other provinces in need. In the face of this global pandemic, Alberta appears to be in a rare position, well prepared for what's to come.
Some people, they'll put in, some resources. Others will say, no, we're all in. And I think Alberta, we saw early on, 2009, 2010 and on, that they took approach of all in.
Pandemic planning experts say Alberta's position is the result of more than a decade of behind-the-scenes work. Nearly every hospital falls under a single provincial superboard, and all supplies are tracked centrally in real time.
When news broke in China in December that this mysterious viral infection was spreading, Alberta knew exactly what it needed, where it was going to need it.
That level of organization may also be why the province has been able to test more people per capita than any other jurisdiction across the country.
You have previously heard me say that we were not able to test every Albertan with a cough or runny nose, but we believe that we may now be at the point where we can do so.
Alberta's response has not been perfect. Some frontline doctors who practice privately have had problems accessing personal protective equipment, despite the province's excess supply.
There are a lot of physicians out in the community like me who are not part of EHS, so we don't get access to the resources that EHS has.
Still, compared to many other places, Alberta is in an enviable place, well prepared in the face of a global pandemic that has caught too many off guard. Heather, Yourex-West, Global News, Calgary.
Vulnerable communities in Canada's north are getting some financial help from the federal government. It will provide $130 million to help territorial governments maintain supplies of food, medicine, and other essential goods and shore up health and social services. And mandatory requirements are coming into force tonight for all travelers entering Canada by land, air, or sea. They will have to have a credible self-isolation plan. Those who don't will be sent into quarantine for 14 days at a set location, such as a hotel.
For example, if their plan is to go stay in a place where there are many elderly family members at risk of COVID-19, or whether they don't have a set destination, if they've been outside of the country for many years, we now have the authority to require them to self-isolate for 2 weeks.
The new series that goes inside the COVID-19 pandemic from the front lines.
We're still in a very critical stage of Canada's COVID-19 epidemic.
To the everyday heroes helping us cope with the unprecedented change.
We want to help because there's a desperate need.
We shouldn't fend for ourselves. We have to all come together and help each other out.
Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.